No, what's that? No, no, no. Wait. Okay. Is that good? Is that good? You did good. Oh, your doggies. Oh, it's got scratches. It's got scratches. Okay, brushy. Is it wet? Stand. Roxy, sit. Sit. Okay. There we go. Are you ready? There are many requirements necessary for maintaining urinary catheters. It is important that whilst monitoring and maintaining a urinary catheter, that you maintain complete asepsis by wearing sterile gloves and hand washing before and after touching the patient. This is to reduce any chance of infection at the catheter site. Once asepsis is being maintained, you're going to check and record the volume of urine that has been collected from the patient. This is done about every half an hour to an hour. You are then going to check the catheter for any blockages present. If present, this should be removed as soon as possible and the vet informed. Next, you will check the flow rate of the urine being collected or the patency of the urine. This should also be recorded on the patient's cage card and file. You should also be monitoring the patient and catheter site for any signs of infection such as redness, swelling or bleeding. Many of these requirements transfer when maintaining and monitoring IV catheters. First thing you are going to do is check the IV catheter site for any signs of infection such as swelling, bleeding or redness, as well as checking that the vein has not burst or the catheter become dislodged. If any of this had occurred, measures should be taken to solve the issue, such as informing the vet, administering antibiotics, replacing the IV catheter, etc. As with urinary catheters, maintaining asepsis is vital for reducing infection chances. IV catheters should be flushed with heparinized saline every 4 hours to maintain patency. Catheters should also be replaced every 3 to 4 days to reduce the chance of infection. If pain is present during the flushing of an IV catheter, this may suggest that the catheter has failed and should be treated promptly by informing the vet and possibly removing the catheter. IV catheter dressing should be removed and replaced at least once a day. Patients should also be monitored regularly for edema or fluid retention in the body through swelling. Intravenous flow rates, monitoring, flushing and replacements, etc. should all be recorded on the patient's cage card and file. Neonatal nursing involves a number of tasks required for the care of puppies, kittens, or any baby animals ranging from birth to about 6 weeks of age. Whelping of puppies and kittens is following birth or an emergency C-section is one example of neonatal nursing. To whelp, you are going to place a newborn pup or kitten or neonate into a towel and begin to gently rub their back and belly to encourage breathing. You're going to want to check their mouth for any blockages, mouth/airway for any blockages, and if present, you're going to want to remove these. To help encourage airflow and remove fluid from the lungs, you can gently and slowly swing the pup or kitten in a downwards motion as demonstrated in the clip. Repeat this process until the patient begins to breathe and squeak and colour returns to normal, which is a good pink skin tone. Once this occurs, the pup or kitten can be either returned to their mother or placed in a basket with a towel and heat packs, as warmth is very important at this age. Once the mum is ready, you should encourage the neonate to feed, ensuring they receive vital colostrum and milk. Pups and kittens, etc. should be weight monitored daily for the first few days of life, then weekly since birth until 6 to 8 weeks of age to ensure their growth is on track. These results should be recorded for later referral. Normal neonates' body weight should increase by 5 to 10% daily. Checks of a neonate following birth include checking the umbilicus for herniation. The umbilicus should be clean with no more bleeding. Monitoring the breathing, which should be regular and even with respiration rate of 15 to 40 breaths per minute with no excessive noises. Excessive noises may indicate there is still fluid in the lungs, which should be treated as soon as possible. There should be no discharge from the neonate's eyes and ears. You should also check for birth defects such as a cleft palate or extra limbs, etc. And you should also check the neonate's colour and gender. Litters should be checked regularly to ensure they are receiving an adequate supply of milk from their mother. Bedding should also be replaced often to keep the area clean. Mums should be fed at least 3 times a day until pups are weaned. In the case of artificial feeding, you are going to want to not feed the neonate cows or goat's milk. Specific supplements can be found at your local vet or pet store, and milk should be warmed to body temperature or 39 degrees and fed according to the product's recommendations based on weight and age. Feeding is usually done every 2 to 4 hours for the first 5 days of life, then reduced to every 4 hours after that. You don't want to rush the neonate during feeding. You should also hand stimulate the bladder and bowels every 2 hours with a wet cotton wool ball to encourage urination and defecation.